Hello, everybody. Hello, everybody. Welcome. Welcome. Just going to wait just a moment here for a few more people to hop on. Happy Monday to all of you. And I realize I can say hello one more time and introduce myself. My name is Oliver Henderson. I'm running the show, as it were, filling in for Billy Gallner, who most frequently assists with technical things for the Somatic Voicework webinars. I'm also happy to be a part of the associate faculty for Somatic Voicework during the Summer Institute. I am just going to type a quick hello into the chat, and we want you to use the chat, but we want you to use the chat only for questions. All of us here are here because we are curious and we have lots of observations to share, but please let's keep the chat clear of extra observations. And if you put your questions into the chat, I am taking very good care to collate those, and we will address them in the Q&A session at the end of tonight. I've introduced myself, talked about the chat. One last thing before I hand it over to Jeannie, I'll just point out, many of you probably are aware of this, but in the upper right-hand corner of your screen, you'll see the word view. And for this kind of event, it's often best to choose the speaker view. That way you'll see the person who's speaking in large format and not the Brady Bunch format on your screen. And having said that, I'm going to let you all say hello to our presenter this evening, Jeannie Lovetri.
Thank you, Oliver. That was a very nice introduction.
You're welcome.
So here we are on the second week of our topics, and I am here to talk to you about transcendence. And you got, as always, you got a handout, and the topic is on this handout. I want you to read it. If you haven't read it, please read it, because this is a detailed document. I am going to ask Oliver to bring up the little slide presentation, but that's an overview of this. It's not the detail that's here. There are a whole bunch of things about somatic voice work that are different in the approach to singing, the training process. And it's very holistic. It's very whole body, whole mind, has always been. And, we don't teach throats or larynges, or we don't teach, the B-flat tenor, what's his name? We teach individual people with lives and characteristics and philosophies and histories and experience. And so when we're working, whether it's with a child or a teen, a college student, a senior citizen, somebody who's returning back to singing, we always want to have the idea that anything is possible. I mean, that's the best way to go. Anything is possible. So even if it feels like there's a limit, from the standpoint of point of view, we want to think there isn't a limit. And so I have distinguished as best I can, as it's a little bit of a semantic thing, what's the difference between a boundary and a limit. And a limit would be something that you struggle against, let me out, I can't get out, I want to get out. And a boundary would be, oh, okay, okay, this is where I am. And I saw a wonderful repeat of the old show Third Rock, which was so funny. And now I can't think. John, well, Lord, senior mind. I can't think of the guy that was the lead, but he's so funny. And he's just stuck in a box. He's been put there by the beings from the planet, and he's stuck in this box. Of course, it's just empty space, but it was so brilliant. And all the other cast members were going in that same direction. So we have a lot of restrictions in the profession. You must sing this way. You can't sing that way. These are the only good sounds. Those are the bad sounds. Your voice has to fit into this model. It has to fit into these modes. You're allowed to do this. You're not allowed to do that. And if we look at those as constructs that guide us, so like for music theater, you need to be a good actor. You really have to know the who, what, where, why, when of the song. In classical music, you need to generate a certain kind of sound to be heard without amplification. And then you have to have a certain awareness of language and of other characteristics. Jazz has different criteria. So if you don't know what those are, it's just all a big salad of sounds. And you want to go in a professional direction, or you want to teach your students that there is such a thing as a professional direction, it's good for you as the teacher to have boundaries. They can be somewhat flexible boundaries, but clear boundaries, and to understand when you reach a limit that you have. And then, if you're a skilled teacher, sometimes you can help the person who's singing, if not transcend the limit, in other words, not necessarily ignore it, but go beyond it. You also have the capacity to say, it's very important to be able to say, well, we've done everything that there is to do in my toolbox. I can't take you past this, but if we accept that these are the limits, we can certainly learn to live within those limits as singers. And so this creates an opportunity for people who maybe have some challenges vocally, who might give up. They might be told to give up. Well, you can't sing anymore because you have blah, blah, blah. Oh. And then if you accept that, you go away and you stop singing. Well, you were told that this couldn't happen. But what if, it's just one opinion, and maybe you could, but maybe you couldn't in a traditional way to teach and to understand that there's all kinds of singing in this world. There are all kinds of people who sing and are quite successful, and they don't fit into the classical model of a certain kind of way is the only way. So when I wrote about that, that was what I was talking about. So Oliver, would you bring up the slides? Okay. So transcending vocal and physical limits. So let's go to the next slide. The first thing you have to know is what's normal. How can you transcend something if you don't know what normal is? And a lot of people who teach don't know. Now that sounds like a pretty big issue. I would say that it is a big issue. But people who teach singing don't necessarily have a baseline for normal vocal behavior. What does a normal voice sound like, and how does one that's not normal sound? And what are the normal responses people make to pitch, vowel, and volume? And how do most people look when the system is working? And what is their body doing as you look at it? And what would be the known established challenges in anybody? Next slide. I have a lot of gunk today. Now, the boundaries that I just talked about are important because you also have to ask yourself, after you've worked with the person for a while, well, what kind of a voice is this? Is this a soft, gentle voice? Is this a pretty big, booming voice? Is this a voice that seems comfortable? Is this a voice that you think, wow, where did that come from? what, as you work, does it seem like it's easy for that voice to do? And what is it that it really has a hard time with? And what is it maybe that this particular person's voice has never done? Could be just because they never thought about doing it. And what was that it did in the past? A lot of people come in and say, "Oh, I used to be able to sing up to blah 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 note, but now I can't." Okay, you want to know that? And what does the person want to do when they sing? So if it's a child, maybe they just want to have fun. If it's a retired person, they just want to have fun. Maybe it's a kid who wants to go to college. You need to know that. Okay, next slide. Now, as I discussed just now, there's a difference between the boundaries or restrictions, and we want boundaries. We want to have appropriate, normal boundaries for our students and for ourselves. And so we want to know what are the comfortable limits of your sound at any given time, and then what are the comfortable limits when you've really been practicing and working and diligent, because then it's probably going to expand. And then when you do effort for something, what's a reasonable effort? You can't do no effort, but if you're struggling to lift the piano while you're singing, why would that be the case? So you have to ask yourself, what's a reasonable amount of effort here? And that goes for your students as well as for yourself. Next slide. It's very good to have a plan. And I don't know why it was inspiring that I put a plane next to the plan, but I was thinking, well, plan to travel, I don't know. It's late at night. You want to tell your student or the parent, if the parent is there with a very young person, what you see, what you hear, and what you're thinking. You need to have a general idea of where you think it would be good to go. And if there's a person has a medical history, it'd be good to know what that is. But the laws are that you don't get to ask for that. The student has to ask for that. So the student has to go to the doctor and want my singing teacher to have my medical evaluation. Please send it to him, her. And as you think about the work, generally you will also have to think about it specifically and tell the student or the parent where you're going to go. And then as you go, you must communicate. So that's all those are very important. Okay, next slide. Now the process between you and the student is a partnership. So you're the guide, but the student has to be willing to be guided. So if the student I had students for a number of years, a long time ago, who had to take a required elective, and they would take either art or music. And in the music, the choice was an instrument or voice. So I had people who took voice because they needed an elective and they didn't want to do art, so they chose singing. But they were really very recalcitrant. I mean, they were there because they had to get the credit, but they really weren't that enthusiastic. That's a difficult situation. Um, and if they don't really want to learn, you're sort of up against a hard position there. And it's good to find that out. It's good to find that out. And again, the value of everything here has to do with communication. I cannot say that often enough. Tell the student what you see, what you hear, what you think about those, and talk to that person about the process. That's vital. You'd be amazed at how many people do this, do this, do this, do this, sing a song, sing a song. Okay, thank you. See you next week. That's not really communicating. So we don't want to, in somatic voice work, we don't want to do that. Next, please. Okay, so now when you're working with somebody, the time frame that you have to work with them, that's part of your plan, matters. So you want to find out, is this somebody who is brand new to singing, no prior training? So again, that could be a child, a teenager, or it could be an adult. And is this a person who used to sing in school or likes to sing at church or sings in some other capacity somewhere else, or this is somebody who just discovered that singing on the planet a week ago. There are people in this world who have never really thought about music or singing until the day they walk in your studio. Rare, but not impossible. And I worked with an adult woman years ago, and when I said to her, "What kind of music do you like?" "Well, I don't really like music." "Well, what about your family? Did anybody in your family like music?" "Oh, no, we never had any music in our home." Oh, I thought, wow, how can you live on the planet and not have no music? You can imagine what it was like to work with her. Oh, well, anyway, next slide. Now, you want to get to a place where you can teach from a place of calmness, which is a very important ingredient for your student to be calm. If you're not calm, how's the student going to be calm? And calm doesn't mean comatose. It doesn't mean like, well, I'm really calm and I'm not going to ever be anything but calm. I'm just going to be calm. No, that's not what I mean. It can be very animated. It can be very lively. It can be very enthusiastic. But it's from a calm center. And then as you look and listen, as you are with the process as it's happening, you are just experiencing, what am I hearing? What am I seeing? How is that in this moment? Not, oh, that's terrible. Oh, that's great. Oh, I hate that. Oh, geez, what am I gonna do with this? Because you're already gonna start off on a lumpy path that way. It is what it is. And this is also from the medical mind. If you go to the doctor and he says, say cough, yawn, he looks in your ears or your mouth, and he's not deciding, oh, that's an interesting ear canal. I've never seen an interesting ear. That ear canal is a nice shape. Okay, so you just are collecting that in the moment activity, and that you are as positive as possible in an honest way. And of course, it's always important to have a sense of humor. And you establish that. You have to say, oh, okay, I didn't expect that. How about that? Okay, let's try again. That's going to make the person feel like, oh, it's okay that I didn't exactly do what I thought I was going to do, or that I didn't do what she wanted me to do. Oh, and I like the idea of having the student make a mistake and go, boy, that was bad. See, then it's safe. And that hasn't got a negative connotation to it. So that sets a nice tone. Next slide, please. Okay. Now, if those of you who are familiar with the composer John Cage, Cage was big on music was whatever you call it. And the famous recital where he came out on the stage, I think at Carnegie Hall, sat down at the piano for half an hour, and then got up and walked off, because that was the piece, just 30 minutes of silence. Apparently, people were very outraged, but he was making a point. And many of the present moment composers broke with traditional melodic construction and established that there were the 12-tone composers, the serial composers, many of the forms of jazz that seemed to break out of a mode that says you can only sing these notes this way. So it's important to get that, because when you're working with people, the bridge is always speech. Now, sometimes the person also has compromised speech, because if it's a vocal fold issue, it can be both singing and speaking, which is why you need to know about what's normal. So if you have a person who's talking like this, hi, how you doing? This is my voice, I want to sing. Maybe that's just lazy speech, but maybe that's the best they can do because they have an injury in their vocal folds, but they still think they would like to try anyway to sing. So you have prolonged speech, you have rhythmic speech, and you have exaggerated storytelling speech. And the story always has a beginning, a middle, and an end, even if it doesn't have words. So you start someplace, you go someplace, and you end someplace. And that could be a mental thing in the part of, on the part of the artist, like I'm going to start here and end there. That also is a boundary. And remember that elongated speech uh, is basically singing. You know, it's a judgment call, but it's a valid judgment call. And for that, I usually use a sentence. My favorite sentence is, "I told you the book was blue," or "I told you the dress was blue." And I've given that in the past as examples because every word that gets emphasized changes the meaning. So I told you the dress was blue. 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 Each one of those is a different sentence. And then I could say, I told you the dress was blue, or I told you the dress was blue. So then you add the emotion in, it changes it again. So when you go over to music, that's also what goes on. And then when I was teaching at NYU, I was working with actors and dancers who thought, I can't sing. And I said, get rid of that. So I made them do all kinds of exercises. And then when they finished, I'd go, oh, guess what? You just sang. And they would look at me. Ah, uh-huh. What? No, that's not singing. Oh, yeah, it is. I think I've been very influenced by working with Meredith Monk for the past 35 or 38 years, whatever it is, because she was in that same group of people as John Cage, and they basically threw the rules away, did what they wanted. So I had them do something like, Mary had a little lamb, its fleece was white as snow, and everywhere that Mary went, the lamb was sure to go. And then they would walk around while they did that. And it was like, well, that's not singing. Well, yeah, actually, that's what rappers do, and that's considered a musical expression. Oh. And then finally you have something like, it was a dark and stormy night, and the wind was blowing strongly. Exaggerated storytelling speech. Now, some people have a lot of trouble doing that, and then that carries over into the singing voice. But there's no reason why you cannot work with that and then say, well, what if that was, you thought of it more as, it was a dark and stormy night. It was a dark and stormy night. Well, it turns into singing pretty quickly. Next slide, please. Was that it? No. Ah, yes, the value of why not. So there's a lot of value in why not. You want to try something, and then you think, oh, I probably can't do that. Oh, that sounded terrible. Oh, that felt so bad. And your job as the teacher is to say, why not? Why can't you do this? Let's try. Come on. Why not? Maybe we'll find something we don't expect. And that means that you have to have open mindedness about what is acceptable, what is music, what is singing, what is voice. And then you have to have courage to continue to go forward. Remember, you're the guide, you're the one that has to be brave. Of course, you have to have patience. And if you try something for several minutes not working, you just go, okay, let's try something else. Let's go in a different direction. No problem to stop and reassess and even laugh about it. And then finally, the process brings up a lot of emotions. So when you're transcending something, it's frightening, it's challenging, it can be daunting, it can be discouraging. There are all sorts of emotions involved, uh, frustrating. Um, so if you're open and the student says, oh, I hate this exercise, you can say, yeah, I know, I hate it too. It's unpleasant, but I really think we need to do it just for a little bit. So just tolerate this a little. It's much better than saying, well, there's nothing to hate. Why would you want to hate it? It's just an exercise. Don't talk people out of their experience. That's an invalidating and disempowering thing to do. And then ultimately the student decides. If the student says, I can't do this anymore, you have to go along with that. They have the boundary that they have gone far enough, and you have to accept that. And you could push on it and say, "Are you sure? You really sure?" But then it's like, when they say on TV, I have to have a lawyer. They have to stop questioning right then, because that's the law. Next slide, please. Now, as you go, you have to accept what is, because that's part of creating a boundary, and then that makes the boundary a choice. Okay? As you have the boundary, you can still keep the boundary and work within it in a way that's free. It sounds very paradoxical or contradictory, and to a certain extent, it is that. And it has to be. Oliver, we lost the slide. Yeah. It has to be that you find what works. So a lot of the time, people are fixing what's wrong, or they're trying to create something that's not there because it's not there. And that's, again, a mindset. Sure, you want to go to create something that's not there, but not because having it not be there is broken. And you don't want to go attend to what's broken. You want to find what works. Can the person do this? Oh, they can. Good. Build on that. Oh, no, they can't. Okay, let me try something else. Maybe they can do this. Or maybe they can do a version of this. Right? And then you want to, as you go with that, you have to deal with the mindset. Now, this doesn't necessarily have a negative impact, but it does mean that as the student begins to trust the voice and the body and the sound, they begin to have personal courage. Like, oh, that doesn't sound so bad. Actually, sounds okay. Oh, well, maybe I could sing at church. I think I sound okay. Right? So then that's developing a new persona. It's developing, you know, Annabelle who can sing. And she's a new persona, or she's a new facet in the diamond. And then when you're working with somebody who has a problem, I use myself all the time as an example. My left vocal fold issue is around between E and A, above middle C. So I never really know exactly what's going to come out. Sometimes it sounds fine, sometimes it goes off some crazy place. So I had to redefine myself as I am a person who sings with this boundary. And do I like it? No. But do I accept it? Yes, I do. And it's because I tried everything that there was to try except medical intervention. But as you know, I'm still teaching, I'm still demonstrating, and sometimes I have to correct the demonstration. But I accepted that boundary as a boundary, and then I worked within that boundary. So that's another important thing. Next slide, please. The process allows you then both to be respectful of the student and of the circumstances, and have the student keep their dignity, but you also keep your dignity and work with appropriateness. So if somebody's struggling, you don't decide, well, you can do this, so now we're going to make it as hard as possible. Or the student wants to sing the world's most difficult song and they can barely get through Happy Birthday. It's your job to say, well, let's hold off on that for a bit. We're not quite ready. And then you probably will have to explain why the song is very difficult for anybody, and that you have to build up the skill set. Or in the case of somebody who has to compromise, say, well, I know you used to be able to do that, but if you don't want to embarrass yourself, you're going to have to say, I can't do that now. And we respect age, ability, respect the style of music that's person singing, and we try to be as honest as possible, as kindly as possible. And then you have to know your own limits. So if I demonstrate and my left vocal cord goes crazy, I have to say, oh, I'm sorry, that was my left vocal fold. I'll try again. Or, oh, today I just feel I just got over a cold. I'm going to show you this sound, but I can't go 100% right now. That's okay. You're a human being. You have a limit. You don't have to sing perfectly every single minute of the lesson or of your own practice even. And then this is the way to trust the student. Okay, one more slide, please. Therefore, you will boldly go where no one has gone before. And when you do, I hope that you enjoy the exploration. You congratulate yourself and your student anytime there's an improvement. And maybe you'll surprise yourself, and in so doing, you may surprise the student. One of the most wonderful experiences as a teacher is the student's eyes get really big. Oh, I never made that sound before. I never made that sound before. I don't even know how I got that sound. That's a great moment, because then you really have transcended a boundary. You have. And the student can then say, oh, I can do that. That's really when you're doing your job. It doesn't happen all the time, but it can happen, and that's really wonderful. Next slide. Thank you. So I do mean thank you. Thank you for trying. Thank you for thinking this way. Thank you for being willing to go in this direction. Thank you for paying attention to these ideas. And thank you for reading your handout, which is the rest of the details. Okay. Thank you, Oliver. So, as usual, we have singers. And that is because the request I get most is to allow people to watch me teach. And I do my best to live the process, and in each moment with the student, I don't know where we're going to go. I don't know how it's going to work out, and so we're all in the moment discovering that together. So our first student for singer tonight is Genevieve. So I'm going to go find Genevieve and say hello.
Hi, how's everyone doing? I'm excited to be here. I'm a little nervous, but I'm stoked.
That's all right. That's all right. Where are you, Genevieve? Where location wise? Where are you?
Yeah, so I am in Frederick, Maryland right now. I outside of Baltimore, outside of DC.
Okay. And I assume you're studying. If you're in Frederick, you must be studying with Roseanne. Yeah.
Yeah, we've been working consistently together for about 8 months, but before that, I had seen her on and off for like 2 or 3 years.
Okay. And how old are you now?
I'm 30 years old.
Okay. Now, what kind of singing things do you do?
So I sing, I'm a front woman in a rock band. We tour a little bit, and we have these big dreams, and I decided it was time to work on some vocal stuff, so here I am.
Okay. Well, that sounds like fun.
It's very fun.
The first thing I want to ask you about is, do you know how you sound when you speak?
Sorta, kinda.
Okay. So if you're going to begin to think of yourself in a more professional manner, how you speak matters. Okay? Because fried speech, which is very popular with young people, is like, oh, hi, how are you doing? I love to sing. Oh, it's so cool. Yeah, okay. So we don't want to do that, because one of the reasons we don't is it's not great for your vocal cords, but it also cancels out the uniqueness of your voice and makes you sound like everybody else who talks like this. Okay? You need to be able to find a place in your throat. Hi, how are you? Oh, this is your voice. So that I recognize you, because I can't really recognize you if you go like that. It's just a habit where there's really no air going out. And it's easy to do, but it's not a great habit. So can you just say to me, hi, how are you?
Hi, how are you?
Yeah, see, I don't want you to have any fry in it. That was much better. Do it again.
Hi, how are you?
Yes. So learn to speak with clarity, and learn to speak so that you're not at the bottom of your voice. Oh, hi, did you have a good day today? Right? Because that cancels out the uniqueness of your own instrument. You don't want to do that if you're going to go in a professional direction. And teachers, your students are going to come in like that, and just tell them it makes you less you. We want more you, not less you. Now, Genevieve, did you sing today?
I did. I'm actually at Rose's house right now. We warmed up, and
Okay.
we should be good to go.
All right. Well, I would like you to sing E. And we'll start here and do E.
Should I stand?
I
Alrighty.
don't know how much of you are going to see if you're in it, but you have the wall
I can
behind
adjust.
you. Okay. Yeah, you know what? Sit back down because we're looking at you're looking at you this way, up this way.
All right, sure thing.
I prefer to look at you straight on. Okay.
E. E. E.
Okay. Now I have another question.
Sure.
I'm assuming that this is your microphone.
I actually have a separate microphone. It's one of the blue ones.
Blue Yeti.
Blue Yeti, yeah.
Okay, so you're not actually singing into this.
No, I'm not actually singing into the little pop star thing.
Good. I just wanted to check. Okay, so far we're fine. Let's go. Back. Continue.
E.
That's it. That's fine.
E. E. E.
Now sing ooh instead of e.
Ooh. 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 Ooh.
Now I want you to hum with your lips together, but still think that your jaw is loose. So you're not going you're just closing your mouth gently. Good. One more. Okay, good. Now I want you to sing May, like the month of May. And teachers, this is all for me. I'm just listening and watching as she sings. I'm paying attention to how it sounds and how it looks. And I'm not giving her a lot of feedback right now, okay? So this is a way for me to evaluate. And so far, she's doing what I'm asking, so that's a good thing. Uh, Genevieve, sing May. May, May. May, 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 May.
May, 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 May.
Good. Now sit up nice and straight.
May, 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 May. May, 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 May. May, 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 May.
Good.
May, 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 May. May, 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 May.
Good. Okay. Now that sounded pretty comfortable to me. How did it sound to you?
Sounds pretty good to me.
That's comfortable, yeah?
Yes.
Okay, so now we're going to try ah, and we're going to do a fifth and then an octave. So ah. So this is a sort of chesty mixy sound and kind of bright ah ah.
Ah.
come in a little more gently on that first note. See if you can control that.
Ah.
Good. Open your mouth a little more.
Ah.
Okay. Now, when you do that, what are you thinking about?
Air.
Okay. Anything else?
Trying not to be too flippy.
Okay. Well, trying not to be is always a bad idea because it's easier to do than to not do. So if I asked you to do in order to be not flippy, I would ask you to just take it easy a little bit. Can you control the volume a little more? And you have to have your mouth open a little bit.
Ah.
Yeah, that was better. Now your mouth is still not really open enough if you're going to sing here in a direction that's going to go toward more rock music. So try to get your mouth open a little more.
Ah.
Okay, so Genevieve, did you open your mouth more?
I actively tried.
Okay, so you have to look at yourself because how
Okay.
else are you going to know? You know, if I say open your mouth and you go like this, you got to see that. You know, you got to look in the mirror and go, oh, look in the monitor. Oh, I didn't open my mouth. So without singing, just open your mouth. Okay, so that's the least you have to do. At least that much, right? So do that first and then sing. Yeah, see, that wasn't so flippy, right? Okay, so how you set up the sound before you make the sound matters, right? If otherwise the sound just happens, and then you have to look at it as it's happening and go, oh. So the goal here is, what are you asking your throat to do, and how clear can you be about what you're asking for? Because it's more likely to do that, and that's a better direction than trying not to do the flippy sound, because you can't control what you can't do, right? I can't
Sure.
not flip. Okay, so let's do this again. Ah. Good. Now, can you make your face a little bit more like you're pleasantly surprised? Ah. Oh, better. It's better. So now you're allowing because you changed your face and you changed the quality of the something different is happening inside in that shape. Ah, so that's actually very important if you're going to sing in a rock band. You got to have that. Do it again. Yeah, now you got to concentrate on your face. Ah. That's good. Now, not so loud. A little softer. Right. That's what you want. That's your target. Yeah. Does Miss Fraley have a mirror there, a hand mirror?
Hey, Ro. Do you have a mirror? Yep, we're fetching one right now.
Yeah. Okay, because I want you to look at the mirror, and I can't have you put it right in front of you because then we won't see you. I want you to turn your body on your head, and put the mirror
Sure thing.
here. Okay.
Thank you. Thank you. Okay.
So while you're doing that, Genevieve, the purpose of the training is to get control over the system while it's working. So if you really want to have the sound be consistent, as you're practicing, as you're warming up, the things that you're trying to do have to become consistent. So your mouth position has to be the same. The amount of jaw space has to be the same. The kind of you're singing has to be the same. The volume control has to be under your control. So all of those things are, when you go over to sing a piece of music, going to help you have stamina, help you stay in the gig for the whole time, singing a lot. And this is really concentration on a lot of detail, right? So I want you to put the mirror, up right in front of your face so you can see yourself. Ah, ah. Okay, try it.
Ah.
Yeah, and you gotta come in lighter on the bottom.
Ah.
That was better. You're gonna come in easy.
Ah.
Yeah, that was good. Now you're gonna sit up straight. Think about your breathing. Think about the ah, and then come in and do it again.
Ah.
Yeah, that's good.
Ah.
Yeah, that's it.
Ah.
Okay, so what's that like when you do that?
Um, it's open. It's a little free, you know?
Hmm.
It doesn't feel like I'm trying super hard.
Right. Now, if you're practicing, do you ever do anything that's close to this?
Um, I can't say I haven't looked in a mirror once or twice while warming up, but I don't think I've actively looked at myself in a mirror the entire time.
Okay. Now, what? Just for this for everybody that's watching too. What is the purpose of looking in the mirror?
To watch your mouth opening and the way that your jaw kind of sits with your mouth open.
Right. Right. So you're looking at something specific. You need to be consistent in that. When I asked you to open your mouth, for you, you felt like your mouth was open, but out here to us, it wasn't open. So the reason you need the external feedback is because your internal feedback wasn't giving you the right message.
Mm.
Right? If I think your mouth is closed and you think your mouth is open, then we're at an impasse. So the outside is where you start first, and being able to hold yourself in whatever position it's in is part of the process of learning to have control over the machine. Now, the we tend to associate rock music with chest register, which is fine. But if you get too chesty, then you get which you don't want, right? So the question then, I fall off this bench. The question then becomes how much regulation can you have, and you got to get light enough so that you don't get because that's
Mm.
not consistent and that's not good for anything musical as well as vocal. So I want you to do the bottom like little laughs, and I want you to think of them as light, laughy speech.
Ha 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 ha.
That's good.
Ha 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 ha.
Mm.
Ha 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 ha.
Good.
Ha 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 ha.
Yep.
Ha 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 ha.
Okay, so now we're going to change this and we're going to land on that bottom note. So it'll be like this. Ha 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 ha. So when you get there, hold on to it.
Ha 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 ha.
Good. Now put the mirror on the side and just look straight ahead and do it without looking at it.
Ha 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 ha.
Yeah. Now you got to keep that because if it closes, then the back's going to close and then you're going to get flippy again.
Ha 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 ha.
Yeah. I would like to see more of your upper teeth. Can we do that? Ah.
Ha 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 ha.
Yeah, it doesn't want to stay there. You gotta say, come on, you.
Ha 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 ha.
That's better. Now that's your target. Don't go past it. Try to get right there. Do it again.
Ha 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 ha.
Okay, so now on that note, we're going to sing, hello, how are you today? Just the one note.
Hello, how are you today?
That was good.
Hello, how are you today?
So when you inhale, I love to sing, hello, how are you today?
Hello, how are you today?
Right. So that keeps you more in a mixy place on that bottom note. That's actually what we're looking for because then it won't flip around so much. Do it again.
Hello, how are you today?
Yeah, that's good.
Hello, how are you today?
Okay, you lost your face.
Hello, how are you today?
Yeah, I know it's a little more work, but that's good work.
Hello, how are you today?
Okay, so now let's do hello, how are you today?
Hello, how are you today?
Yeah, good. Breathe nice and full all the way through your body.
Hello, how are you today?
Good. Can you sing the bottom hello a little brighter? Hello, how are you today?
Hello, how are you today?
Right. Because if you sink into your chest register with all that effort of then you can't get out of it without a crack, okay?
Hello, how are you today?
Good. Now, what volume is that? If 1 is very quiet and 10 is very loud, what volume is that?
I feel like that's maybe a 4 or 5.
Right. I would say that's kind of where it is, right in the middle, yeah? So let's do that, but know that that's where you're going, yeah? Hello, how are you today?
Hello, how are you today?
Mm.
Hello, how are you today?
Good. Now, can you do it like in a 6 or 7?
Hello, how are you today?
Good.
Hello, how are you today?
Yes. Now, Genevieve, on the way in, it's kind of mental game here. The process is a loop, and it starts when you inhale. It doesn't start when you make the sound. It starts when, as you inhale, into the shape of the hello, because that's where you're going to sing out through that pattern. It has to sing through this sound. So this is why it's important to be able to set up the front anyway to hopefully talk to the back. Hello, how are you today? Hello, how are you today? And then that's also a little bit going to help you stay on the chest side without flipping over the head. So try again.
Hello, how are you today?
Yeah, that's tricky, but that was good. Do it again.
Hello, how are you today?
Good. So now we're going to try. Ah, and this is like a 5 or 6. It's not super loud.
Ah.
Yeah, so you're doing do, re, do, so, do, or 1, 2, 1, 5, 1.
Ah.
Yeah, so just listen. Can you sing that?
Ah.
That's right. That's the musical pattern. Good. Do it one more time so you know where it is.
Ah. Ah. Ah.
Good. Now, can you do that with your mouth open?
Ah.
Yay! That's it. That's good. mentally, if you could look inside your mouth, we have this big set of muscles back there that's called the soft palate. They have all kinds of, palati elevati and all kinds of names. But basically, it's where your uvula hangs down. It's a big sheet of muscle. When you go, if we're lucky, it lifts and spreads like a proscenium arch and curtains on a stage, right? Then it needs to stay there. Now, do we need to do that when you talk? No, we don't do that when we talk. I don't know, I talk like that. But in order for you to get the sound you need space. And there isn't any direct way you can make space except through your image and through your face. So when you're doing now there's other things going on. There's things in your larynx and your vocal cords. But it's not going to go there if you don't have that nice, big, open, stretchy place. So let's try this, and you think about, I'm trying to make a nice, wide feeling in the back of my mouth by changing my face. Oh, sorry. Good. Now, lift your head a little bit and do it. Yeah, that was good. Sneak up on the first note. Don't pounce on it. One more. Breathe in through the shape. Yeah. So what is that like when you do that?
Well, it does feel wide and open, and it's like the notes sort of come out easier.
Mm-hmm.
I feel like I have to work a little bit harder to hit the right notes.
Well, you probably do. That makes sense.
Yeah.
Now, do you want to sing a piece of music for me, or no?
Sure. Yeah, I have something prepared I'd love to sing more for you.
So I'd like to hear it.
Sure. Do you want me to jump right in? 3, 2, 1, or?
Yeah, jump right in, wherever's comfortable. And is it something we would know, or something you wrote, or what is it?
So I'm going to be singing a Paramore song today.
Okay.
It's called Brick by Boring Brick.
Okay.
Okay, I guess I'll start at the beginning. She lives in a fairy tale, somewhere too far from us to find. Forgotten the taste and smell of a world that she's left behind. It's all about the exposure in the lens, I told her. The angles are all wrong now, she's ripping wings off of butterflies. Keep your feet on the ground when your head's in the clouds. Go get your shovel and we'll dig a deep hole to bury the castle. Bury the castle. Go get your shovel and we'll dig a deep hole to bury the castle. Bury the castle. Ba-da-ba-ba-da-ba-ba-da.
Good. Okay. Now tell me, evaluate yourself. What kind of a register quality were you singing in?
Well, what I've been struggling with is I'm sort of working on a higher pop belt. It's still kind of too mixy, and I'm trying to get a little more oomph in there.
Okay, so you were singing that mostly in a head mix. Do you know that?
Yes.
Is that what you want?
I think I can, I can bring more oomph in there. I can bring up a little bit more chest.
Okay, so right now, that's not happening. And because it's not happening, that flippy place is always over here going, I'm here, I'm over here, ha, don't forget me, I'm going to come in, ha. The exercises we just did are to make that go away. But you have to work on taking your chest up in the exercises. Because it's not going to show up in the songs if you don't, right? So, when we were doing or that high note there, that's chest. And you have to actually get there in the exercise, because if you don't, when you sing the song, it's going to come out like that. Oh, I'm going to come out and sing like that. And then you're not going to like it, because it's going to not sound like what you would really have in your mind to do. So is that clear?
Yes.
Okay. So how you get to take chest register higher is by taking chest register higher in the exercises. Does that, I mean, you understand that, right?
I do.
Okay, so let's do this. Let's go back and do ah. So let me talk to the teachers who are watching. Is that okay with that?
Yep.
Okay. So teachers, especially the women who are classically singing, classically trained, the quality here is this chest register speech. And if it's too heavy, it doesn't work. It doesn't go up. And if it's too light, it doesn't go up. So one of the reasons that I had Genevieve sing ah is because she was wanting to go ah, and then it goes because the vocal folds are going, I'm not taking all that pressure on the way. And then you get an abrupt shift at the level of the larynx and the vocal folds. And this question comes up a lot, over and over and over. Well, how do I take chest up? And this is where people get confused. Oh, put the sound in your nose. Make it more nasal. Make it more nasty. Make it more like you're yelling. Okay. All of those are devices. They could work. They could work. But that is actually never going to be a substitute for, the quality that comes from the vocal folds. So, I want to go to your house. I want to go to your house. That's louder, but that's the same place, right? It is a very nice day. It is a very nice day. And I open my mouth. I have to lift my head. It is a very nice day. If you do that on a regular basis, it'll go higher, right? So this is the functional question is, here's the boundary, here's the limit, and this is how we're transcending the limit, right? So, Genevieve, let's try again. Well, let's try the octave. And you can lift your head just a little bit. Ah. So you're trying to stay in this chesty mix place.
Ah.
Okay, so I changed the musical pattern on you because I did a fifth and then an octave. So see if you can do that. Good. Now your job as we go higher here is to keep the volume the same because your throat's going to want to make the high note louder. So you see if you can start with the bottom note as a louder one. Okay, so that was a transition, a nice transition actually, into head mix, but we're not going into head mix. We're staying in chest. So do it again. Sorry. Okay. So you need to sing no, 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 no.
No, 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 no.
Yes, and try not to do no. Just enough so that it's there, not more than that. Do it again.
No, 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 no.
Good. Try to sing a little more no, with your mouth a little more oval shaped.
No, 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 no.
Look at me. No, 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 no.
No, 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 no.
One more.
No, 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 no.
Yeah, think about your breathing before you come in. Think about the O.
No, 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 no.
That was better. One more.
No, 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 no.
Okay, so now as you're singing that, the sound goes from O to ah. no, 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 no. And I want you to try to stay no, 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 no. Even if it cracks.
No, 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 no.
Okay, that was pretty good. Do one more. Make sure your mouth moves on each no.
No, 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 no.
Right. Now that was the first one that the chest equality stayed and went higher. Did you know that?
No.
Right. 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 I mean, you didn't. So it's not going to go there if you don't notice when it's there that it is there. Right?
Makes sense.
So, yeah, right? So when you're saying to your throat, hey, throat, stay here, throat wants to know, well, what here are you talking about? Which here? And the thing is that the sound you were making in the song was a good sound. It was correct. It was proper. It was, everything about it was great. It's just not the sound you want. Right? So it's not like, well, that's a wrong sound. No, as a sound, it was good. It's just wrong in terms of the style and in terms of the context of the music you want to sing. Right?
Right.
Now the good news is once you really knew what you're asking yourself to do and your throat to do, it did it. Hey. So let's try it again. The O is useful because it helps change the shape inside. Instead of doing this one, now we're doing this one, and that helped you stay more in chest. So this is a little bit of zigzaggy. Go here, we go there, go here, go there. So let's do this again, and then I have to stop. Just do one more. No, 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 no.
No, 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 no.
That's it. That was great. See if you can keep going the same place.
No, 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 no.
Yeah, it's work, but that was it. Good.
No, 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 no.
Yes. Yes, yes, yes.
No, 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 no.
Yeah. Okay. Now, as you get used to that, when you have the first phrase of the song, what was the first phrase of the song?
She lives in a fairy tale.
Okay. So, say for me, she lives in a fairy tale.
She lives in a fairy tale.
Okay, so it wants to crack, right? So stay on the chesty side. Hello, she lives in a fairy tale.
She lives in a fairy tale.
Better. Do it again. Lift your head a little.
She lives in a fairy tale.
She lives in a fairy tale. Fairy tale, not fairy tale.
She lives in a fairy tale.
Yes, that's the one you want. And everybody listening, this is a small difference, but it really matters. So the third time was the charm. See if you could go back there, Genevieve. The job is, can you find what you just did over and over? Try one more time.
She lives in a fairy tale.
Yes! Okay? Now sing the phrase as close to that as you can.
She lives in a fairy tale.
Okay, so that's much higher than where you were. Sing it a little, sing it a little lower.
She lives in a fairy tale.
She lives in a fairy tale.
She lives in a fairy tale.
Okay, now you tell me, is that chestier or not?
I don't think so.
No. It was the same place, right? So this is your boundary. This is what you have to transcend. And you can do this. You can absolutely do this. I can't do it with you now because I don't have any more time. But every time we went there, we got a little closer. And a lot of this is for you to pay attention a little more. Just asking yourself, where am I going? Okay? Are you cool with that? Is that okay?
Yeah, thank you so much for helping me out today.
Well, you're so welcome and so thankful for you being a volunteer to be here. So everybody, applause, applause, applause. Yay! Wonderful. Okay.
Thank you.
Yeah, you're welcome. So now we're going to talk to Sandy. And Sandy's in San Francisco. So
Here I
hi,
am.
hi, Sandy.
Hi there.
And so Sandy is a wonderful jazz artist and teacher, and she is very experienced in wonderful improvisational music. And is there something in particular we want to work on, Sandy?
Yeah, well, I'm my I guess limitations that I'm feeling are as I'm aging. My voice feels differently, particularly in the middle, and the I would say the E to A range in between middle C and the C above. Um, Harder to find a good place to sing those pitches in tune, and I'm still performing, and it's challenging music, and I'm trying to figure out what's the best way to go with the way things are changing.
Okay. So the first order of business is whether we like it or not, if we're going to keep singing and not do something that we don't like, you have to find out what you can sustain as a pitch. Because fortunately, if you're doing improvisational music as opposed to something else like maybe music theaters or there are the expectations where you have to sing 2 beats or 3 beats, in improvisational music, if you want to clip the note and make it short, nobody's going to object to that. So you want to find out which pitches and which vowels will you be able to have control over to sustain and which won't. So for myself, as I was doing, I was trying to get back on the horse with my own throat. I got pretty clear about I can go this far, but if I go that far, then it falls apart. And I ended up singing in the middle a lot quieter than I would have in the past. But if I stayed within that quietness, I could control things okay. And I'm not performing. Since COVID, I have been not even performing in terms of the institute. So that's our first order of business. And then the second thing is, once you figure out where that is in the pitch range, how consciously can you be there while you're in the music? Because that's really the next thing, is you want to be able to sustain consistency. So why don't you sing for me, well, let's start down low and sing E-ah. E-ah at a comfortable volume.
E-ah, E-ah.
Okay, now can you change that enough so that you can be on top of the pitch here?
E-ah.
Okay, so you're still flat. Do you hear that?
Not in the moment, but I trust you.
Yeah. So it's my job, since I know you're singing at a high level professionally, I can't let you get up and sing flat.
Right.
If you're a student and you're figuring out what's what and you go a little flat, I might go, okay, or a little flat, never mind, keep going. But with you, I can't let you do that because, you don't want other people to say, Jesus, she's so off pitch. That's no good. So here you have to try to do a little bit of what I just did with Genevieve, which is you got to sing this lighter. More on the head side. So can you do that? Try that. That was a little better. Go on. See if you can get on.
If I start there, I can. So I'll think about that.
Right. So that balance is workable. Mm-hmm. Okay. Now it's a hair's breadth under, but right now that's not as important as getting there, because the other one was actually very audibly off. Right. Mm-hmm. So first thing you say, well, we're being headier. Okay. Well, you know what that means. You have that knowledge. Mm-hmm. Somebody else might not, but you do. Mm-hmm. So stay as light as you can because you got to get to the pitch. Okay, so the first one didn't get there, but the second one did. That's why we do it twice. Do it again. Right. Okay. Now, that's work. I know that's work. But let's see if we can help your throat do it with a little less work. So the first thing I want you to try is tongue over the straw. So you got a straw?
Mm-hmm.
Okay, so here we're going to do like in pen. I'm going to do it lightly. So this is like a heady mix if we're lucky. Yep. Okay, so the first one was a heady mix and the second one went to chest. So you don't want to go into chest. Yes, whatever that was, that's where you're going. Try it again.
It just doesn't want to go there.
Right, it doesn't. So that's a vocal fold thing. Well, the vocal folds don't want to respond to what your brain is telling you.
Exactly.
Okay? It's not like, and this is very important for the teachers. Teachers, if you have an experienced, skilled artist like Sandy, you don't want to say to that person, you're not listening to the note, you're not listening to the note. And you don't want to say, well, you're not trying hard enough and support more. That's insulting. This is a highly skilled artist, been singing for decades. You don't say that. But you do say to yourself, okay, there's a lot of effort there, and she's still not going where she needs to go. What else is going on? So when the instrument is no longer responding to the brain, then we have to say, in a way, because the brain tricked the throat to do something it doesn't want to do. And actually what Sandy just did is that. Now maybe it's not a polished, finished thing she's going to sing in a piece of music, but as an exercise, it got closer to where it needed to go. Right? So when we're working with this function, and we're working with trying to solve a specific issue, in this case, control, how close can we come to control in virtually any kind of sound, whatever the sound is? Forget the labels, chest, head, mix, purple, blue, plaid, green, who cares? Is how much control does the person have when the vocal folds don't want to do what they normally do or have done? Okay, so Sandy, that was actually pretty successful. Start on the bottom in the lightest sound you can do and still get a sound, okay? Yes, like that. Good, one more. Go as much ahead on the top as you can. Yes. Okay, now, tell me how much effort that is on the 1 to 10 scale. Like 10 is lifting the piano.
It's like an 8, and it's not like a feeling muscular 8. It's like my whole body, my breathing system, like my butt.
Yeah, it's work. Because you're compensating here for the fact that the machine doesn't want to go where it needs to go, right? And so, like with me, with my hip replacement, when I go to physical therapy, they're trying to get my leg to do what the right leg just does. The left leg is sort of kind of not doing. And so they're trying to strengthen it. They're trying to help me balance better. All the kinds of things that I've lost because the surgery was done badly. So here, what we're saying is, if you do this and you know that you just were where you were, then that's where you wait for the bus over and over and over. You have to stop after 4 in a row and rest. Then you stop. We're not trying to do as many as possible. We're trying to do several and then give your body and your throat a break. Okay? So you did great. Do it again. Keep forgetting the straw. Good. See, it's getting better. Good. One more. Go up. consider those successful because they're all on pitch. Okay? That's the first order of business, right?
Mm-hmm.
Can you go on a couple more? Good. One more. Good. Okay, now take the straw down. Let your tongue go in and sing but do the same exercise. Okay. So that's a little lighter and a little easier and a little more accurate, which is great. Right. Now, same thing as I said to Genevieve. Use your face. I love to sing. Good. Now it's the E where you said, you have the problem right here. That's where it always is. It's right in the break always for
Right.
everybody. You have to think of making that a little bit headier.
Okay.
Right. See, then that corrects the pitch problem. That's good. So now we're going to do on this in that same pocket, right? Yeah, 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 yeah.
Yeah, 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 yeah.
Right. Right. So now all those pitches are accurate and you went through the hole. And we didn't hear a hole. Yay.
Yeah, 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 yeah.
Good.
Yeah, 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 yeah. Yeah, 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 yeah.
Good. Now sing May.
May, 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 May.
Good. Watch the first note. Don't get too heavy.
May, 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 May.
One more.
May, 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 May.
Okay. What was that like to do?
Felt pretty good. Felt pretty even. There was one of the first Mays when I was heavier on the bottom felt flippier on the top.
Right. Okay.
Yeah, I feel some evenness. I don't know.
Right. Yeah, that's the first order of business is to get the two registers to talk to each other somehow or other. And for myself, I have to sing very lightly through there if I'm going to get through there, because if I go where the music wants me to go, where my heart is pulling me, I can't sing. So that's hard because you want to sing "The Hills Are Alive" or whatever, and the throat's going "The Hills Are Alive." You can't do that, right?
Yeah.
So here, you're asking the machine to say, okay, where are you willing to go? Where are you willing to go? And it'll tell you, okay, I can do what I just did. Oh no, I can't do it that way. And then that's the boundary and the limit, which as long as you know that's there, you can do. So let's do straw phonation now. We're going to use the straw like a kazoo. And we're going to stay on the light side. So it's still going to be kind of like here. Hi, how you doing? Light. Good. Now the fifth is under. See if you can get there. Yes, that's on pitch. Right, the second one was good. Whatever that is, that's where you're going. Yeah. Yeah. Now, Sandy, on the first note, see if you can get a little more toward the nose. Really more like Do it a little louder. Yes, good. Second one actually was dead on. First one didn't quite get there. Right, it's work.
Yeah, I'll say, it just feels like my body doesn't want to ascend. My brain is saying, my brain knows where the sound is that I'm heading for and that I always used to be able to do.
Yep.
And
Yeah, it's not your body that won't go. Your body's doing okay. It's more work. It's your vocal cords that won't go.
yeah, and
Okay.
whatever stretching my vocal cords, I guess.
Yeah.
Right.
Yeah. The cricothyroid muscle, which is responsible for stretching and thinning the vocal folds so we can raise pitch, might be affected by nerve issues. Like, there's the two nerves. And, I mean, we really don't know that. I mean, I don't know that. A doctor might know that, but I don't know that. So the effort to sing higher, which your brain understands great, your throat says, what? And this is the issue here with doing any kind of work where you're dealing with the function where there isn't a response like there once was. So what you were doing was really effort, but good effort. Okay, so we talked about what's reasonable effort. This is reasonable effort. So let's do it again. And my high note there goes a little bit to head. That's okay.
Uh-huh.
That's good. 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 Okay, now put the straw down and just go to head register and do woo.
Ooh.
Do it again.
Ooh.
Okay, now ee.
Ee. Ee.
Right. So sometimes if you get out of the hole and you go above it, when you go back to the hole is a little bit less wobbly. So let's do very heady E. And it can still be a little mixy. It doesn't really matter. E. Yeah.
It's
Now
talking back to me.
Yeah. On the way up, open your mouth a little bit. So your tongue can move a little. That was good. Right. Good. How loud would you say those are?
They're a good 8 or 9. I have
Yes.
trouble singing quietly in this.
Yeah,
range now.
that's not where you're going to go right now.
Okay.
This is going to have to be loud, but it gets you there, okay?
Okay.
Yeah. Good. Now, maybe in the lower pitches here, you can start a little softer. See if you can sneak up a little more on the first note. Ah, that works. Good. Let's try that again. Good. Those are great. One more. Good. That's good. Now, let's try a little bit more articulation and movement to get everything bounced around a little bit. So do glockada, glockada. Glockada, 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 glockada. And still think of this as, glockada, glockada.
Okay.
Not glockada, glockada. Okay?
Glockada, 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 glockada.
That's good. Come in easy on the bottom.
Glockada, 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 glockada.
Good. Now, can you do a more glah? Glockada.
Blah. Glockada, 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 glockada.
Yeah, that's actually a little more spacious and it just makes it sound a little warmer, which is aesthetically it's nice.
Glockada, 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 glockada.
Good. Do that one again.
Glockada, 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 glockada.
Good. That's good. Come back down.
Glockada, 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 glockada.
Yeah. Maybe this is confusing, Sandy. If it is, don't do it. But can you think that the first note, where you start the first note, is a little bit more on the lifted up side, like the sneezy side? Glockada.
Ah. Glockada, 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 glockada.
Right. That makes the whole thing there a little more uniform. So I don't hear a lot of shifting around. But that means you have to aim the first note all the way as far up as you can get it to go. Glockada.
Glockada, 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 glockada.
Right, so that means these, which are the weak ones, are right on the center of the pitch. And that's really the first order of business here. Can you do it again? I'm going to wait for the boss, basically.
Glockada, 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 glockada.
Yeah, that's good.
Glockada, 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 glockada.
Yes. I love this thing.
Glockada, 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 glockada.
Yes, I think those are consistent. What do you think?
Yeah, they feel consistent. Sometimes a little bit on the way down, it feels like it backs up, and I think
Right.
the sneezy thing brings it more forward.
Well, it lifts it up a little bit. I wouldn't say it
Lift it
brings
up.
more forward.
Okay.
Now, obviously, we don't get around to singing like this all the time.
Especially in Portuguese.
Right. So these are compensatory exercises.
Sure. Uh-huh.
Okay? Because if you were to go to this place like that, it's probably going to not go to the pitch. And then what good is that, you know?
Right.
You have to go where you can sing the middle on pitch in whatever quality of sound that is. Because not to do that is to have the pitch be audibly not on the center of the pitch. And so this has to do with, the overtones get dampened if the sound gets too heavy. And it's kind of like singing with a mute in there, and it doesn't actually go where it has to go. Now, versions of this are the tug out, the baby cry, the wah, 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 all that. And this is where the brain, the persona part comes in. And so I'm talking not just to you, but to everybody. So if you have sung your whole life in a sound like this is my sound, I sing here. Everybody knows that this is my voice, this is where I sing. Except that now, because of neurological whatever, now you're going like this, and I can't sing like that anymore because it goes flat. Okay, well, so then your brain has to be willing to go, oh, I need to sing like this. I need to sing this way. I don't know why am I going to sing like that. Because nobody actually cares out in the world. I mean, it's all kinds of, you could go find an example of any kind of quality of sound you want in somebody somewhere. Why we care is because we identify with, this is how I sang. This is how I am. Good. Right? And if you carry it to an extreme position, like, well, what if you were a pianist and you were in a car accident and you lost your hand? You still have another hand. There are pieces written for one hand. Do we choose, oh, that's great, I want it? No, of course not. But something is better than nothing, at least in my world. Mm-hmm. So Sandy is making a musically viable sound, and she will have to work with that until it gets a little easier, simply by repetition. Now, again, I'm going to say, I have never seen anybody do this anywhere, and I've been teaching for 51 years, and I've been to all kinds of conferences with all kinds of people in all kinds of circumstances. And the medical profession, basically, they give you a shot, either it works or it doesn't, and if that doesn't work, then if you're really severe, they can do surgery and actually pull your vocal folds to a tighter place, and that could somehow work also, but it's also a hit or miss kind of thing. And then the rest of the advice is, well, don't sing. You're older now, and, you had a career, and just, make the best of it. And I come along as an upstart and say, no, we're not saying that to people. who says that they can't do better, even with the problems they have?
Mm-hmm.
And this is not something you can go out and find any old where. And it is too bad that that's the case. But this is also why having a technical background or a functional background is Sandy understands if I say to her, what does it mean to sing headier? She doesn't look at me like, what's that? She's worked on that. She knows what that means. So if we have a way to, a resource of some kind to say, let me get brighter, let me get breathier, let me get more forward, or let me get more heady, and that's meaningful to the person, then that means she has something upon which to fall back. She can fall back on, I can still sing this way. And I've had singers in here who have, mostly it's, I would say these have been from jazz, highly skilled vocalists who have always sung, but they never had any training. So when I'm asking them to do this or that, they don't have access to that. In fact, one woman even who had been singing for decades said to me, I did your whole course. I did all 3 levels. I still don't understand head register. And I said, well, because you don't use one. You don't have it to use. So therefore, it doesn't mean anything to you. And I said, you don't actually use chest either. You just sing in a nice, comfortable mix. Except that this woman was now into her 70s and it didn't hold up anymore. And so my doing with her, with what I am doing now with Sandy, was impossible. So, Sandy, your responses are they may be a lot of work, but they're good. They're right effort. And as you do those, then you may not have to go quite so far to here, but it would still give you enough let's say pitch accuracy so that you could get away with singing. And at least the good news is about most of the Brazilian music doesn't have to be really loud. It doesn't have to be super belty, right? So let's do glockada glockada on the light bright side. Glockada 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 glockada.
Glockada, 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 glockada.
That's good. Watch that the bottom's not too heavy.
Glockada, 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 glockada.
Yep.
Glockada, 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 glockada.
Okay, now here's the curveball. Can you sing it more breathy?
Glockada, 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 glockada.
Right. So that's another way to camouflage that it's not consistent, and in certain music, singing a little breathy would be okay. And then you have to take more breaths because you're going to run out faster. But that's an all right device in some styles, not in every style. So that's another option. So like if you want to have, you want to sing something and sound different, make it slightly more nasal, make it slightly more breathy. And still that register balance doesn't change, So you can do glockada, 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 glockada up in the nose, or glockada, 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 more breathy. And those are slightly different palette colors to play with, but still not going to go or go off pitch, right? So go back to the moderate one that's in between. Glockada, 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 glockada.
Glockada, 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 glockada.
Good.
Glockada, 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 glockada.
Good. Now your high note is a little bit, you're going to have to reach a little. Glockada.
Glockada. Woo. Glockada, 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 glockada.
Excellent. That gets you there. All right. Now the next thing is, if you're going to sing a piece of music, what does it do in the music? Can you sing a phrase or something for me?
So I had this tune that I think I sent ahead. I'll start in the middle. It starts really low. Mas se tiro do lamento novo canto, outra vida vai nascer, outra vida vai nascer. Vou achar novo amor, vou morrer só quando for in the style, but
Right, right. Well, now the next question is how much control over this can you do if you made it breathier? Can you make it a little breathier?
mas se
And
tiro do lamento. I'm just figuring it. Mas se tiro do lamento um novo canto,
yeah.
outra vida vai nascer. Now we're going to the apex of the song, though.
Yep.
Vou achar novo amor.
That's good.
Vou morrer só quando for. And the vowel sound, like if I had to go, E would be so easy, but so why is that fa, E?
It's
One
because
is so much harder than the
because
other.
the open vowels, the air that you have to sing in the open vowels it dissipates the pressure inside. So the ah and the o are going to be much harder than the e and the oo. Because the e and the oo have a smaller space inside, there's less turbulence, and then it doesn't get away, and the vocal folds don't have to do so much work. On the ah and the e, when I was first working, the vowel ah vowel, I couldn't hardly sing an ah vowel. I was like oh oh, but as they got stronger, I was finally able to go ah ah, which I can still do now, but it didn't come for a while. So now this is another thing where uh I can't I can't do Brazilian jazz. You know I can't do that. But if I were to sing the one and only song all Americans know is tall and tan and young and lovely, right? So there's then tall and tan and young and lovely, tall and tan and young and lovely. Oh, but I watch her so sadly. The keys there might make a difference in how far are you going to go, and maybe you're used to singing it in C, and now you got to sing it in A. Who cares? If that's going to get you to the high part of the song in a way that's musically viable, change the key, right? And so you got to accommodate the weakest link. Always accommodate the weakest link. And where is it that it's the weakest link? And then if you don't sing past that, nobody knows it's the weakest link. They don't. And so for us as professionals, the first thing is, where can I go and stay on the top of the pitch? And
So
I don't care.
like the tessitura of this song starts. Tanta gente no meu rumo, mas eu sempre vou só.
Right, right. So if it stayed down there, you'd be fine, right?
Yeah.
And so you have to sing the bottom like that, so it's down there and not like that. How heady can you make those low pitches?
Tanta gente no meu rumo, mas eu sempre vou só. Dessa terra desse jeito, já não sei viver.
Okay, now there, go to head. Viver. Right.
A low E. I mean, a middle E.
Yeah, but that got you to the note. It got, yes.
Okay. Deixo tudo, deixo nada, só do tempo eu não posso me livrar. E ele corre.
No, wait. You can't go there. You got to do the bottom to match where you got to go, right?
E ele corre para ter meu dia de morrer.
Right.
So it's okay to sing that light and breathy on the bottom. It doesn't
You have no
unanger
choice.
me.
You have no choice. And the Brazilian Portuguese music is no one's going to care. You know, if you were trying to belt some Broadway show tune, well, obviously you couldn't do that.
Right.
But that's the advantage of the music that you do. It's very variable. And you know, if you think again, if you twist your mind around, and you think, well, if you think of yourself, I don't like to talk about necessarily acting because I know that could be a loaded word, but I recently worked with somebody who was 81 and had been diagnosed with vocal fold issues, and she was going to do a performance with other people who were Broadway professionals, and it was a revival just for one night for a special occasion. And the voice came around. We did a lot of work, but she only had 3 weeks that she worked with me. So where we were working on the song, where she had done this song a long time ago, many, 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 many times, and it was in muscle memory in her throat, I said to her, look, as an actress, you might want to go, la-dee-dee. And I said, you can't, your throat won't do that, so you have to go, da-dee-dee. I said, try to be more playful, more coquettish, more teasing. And she, as an actress, that was something she could just do, and it worked, right? So if you're going to sing and this, then you can go higher. Sing there. Nobody's going to come along and say, well, Sandy, you don't sound like yourself. Many people, whenever we sing, have never heard us before.
Mm-hmm.
Right? So the first order of business, and if you can't really always tell that you're off pitch, just make sure you record it. Mm-hmm. So that you can have that feedback. And then if it's flat, you got to get lighter. Somehow or other, you got to get lighter, because that's going to help the pitch issues. And the baby sound thing also is going to help correct the pitch issues. Okay, so that'll keep you out of trouble for a while.
Let's hope so. Thanks so much.
Thank you so much, Sandy, for doing this. It was really great. Everybody, applause for Sandy. Yay! All right. Now, Oliver, we must have some questions. You want to give me some questions?
Sure. We had 2 questions come in that were related to the work you were doing with Sandy and the straw. This was the tongue out work, not the semi-occluded work.
Yeah.
So generally, there's an interest in hearing about what was that work about, the tongue over the straw in Sandy's particular case. What was that work about?
Okay, so if the vocal folds are not doing their job, for neurological purposes, that there's been an interference in the response. And that can come from a virus, it can come from COVID, it can come from any, God knows, has nothing to do with singing. But once it's there, it's there. And the nerve's not getting the message from the brain, it's not. Okay, so then we're trying to say, in spite of the nerve not responding, can we get a response anyway? So when you're working with the tongue out over the straw, in a throat that's not working optimally, the throat tends to close. That's a common issue. It can close benignly, or it can close in a more aggressive way, like constricting and going, I can't sing because it's too tight. So obviously that's not what Sandy was experiencing. Her throat was not constricted. But because the mechanism doesn't respond well, the inside walls of the pharynx can collapse a little bit. And so then the sound kind of gets muffled. Not a whole lot, but enough so that it's harder for the overtones to actually be amplified enough so that she's on pitch. So like her mind is singing the pitch, but her throat's not giving her the amplification of the pitch that we need in order to hear it as being on pitch. So when you put your tongue out over the straw loosely, you're saying to the muscles in the back to lift and stretch without being tight. So then I'm not getting any argument from here. And then as a chain reaction, as you go inside, the mechanism, the vocal folds, are more likely to get that thyroid tilt inside. So the thyroid cartilage is in the throat, and when the cricoid contracts in the front, it tilts, and then inside the vocal folds stretch. So this is another way to get the pitch change to be a little easier. And so it's a little bit around the Pat Murphy's barn, but as she was doing it, she was getting more pitch accuracy, especially between the registers. So the tools that we use are devices to help the response be better. And sometimes they're very indirect, but if you do them enough, repeatedly, that muscle memory begins to come in and strengthen the response, which on its own wants to go away. And so when I go to the therapy once a week, I go in the pool. They put weights on my feet and my legs, and I have to, do movements in the pool with the weights on, which the resistance in the water is strengthening my leg. And so this is the same philosophy here. And it isn't like this is going to cure the nerve issue. It's probably not going to happen that is the case. Then I would really make a lot of money. This is compensatory. This is to say, how can I get other stuff to help, other stuff to fire, other stuff to come in and give me a better response, so that if I'm in a piece of music, I can get up and sing it and nobody would know necessarily there was anything going on. And so this is what I meant when I say find what works and then try to get that to be replicated so that you can do it over and over and over and over and sing in a piece of music and know where that is. Right? So Sandy was really more about finding the boundaries of what she can manage to keep together. And Genevieve was really more about establishing better boundaries between her pitch, her vol, and her volume in her middle voice, so that she goes a little more to chest register than her throat on its own wants to go. I sort of didn't like the idea that she wanted to stay in chest. And again, it's not that there was anything wrong with her head mix. It was perfectly wonderful. But it wasn't the sound she wanted. Right? So if the training process from a functional standpoint is going to help the person sing the music they want to sing, we have to adjust the training so that it gives us the result that the person needs in the music. Okay? So if she was singing music theater, that sound would have been great. But that wasn't what she wanted. Okay? What else, Oliver?
One question just came in that I think maybe you essentially just answered, and I noticed this as well. Didn't necessarily see Sandy's tongue super well, and I assume that the tongue of the straw is largely about that.
Well, yes and no.
Okay.
The tongue, when the throat is collapsing or closing, the tongue will pull back into the throat. Not that the person is not pulling it back, it pulls back. Okay, so that's a very important difference semantically. You don't say, oh, you're pulling your tongue back. No, the tongue is pulling back because the person is doing the tongue out over the straw. That's their conscious intention. But the throat's response is, I'm not happy there. And I have a lot of trouble with my somatic voice work teachers because they don't seem to get this. Oh, it's not working, therefore I'll show them how it's not working and then they can correct it. And that's not what somatic voice work is about. Somatic voice work is about you, teacher, go, oh yeah, the throat's closing here. Let me do this other exercise. Let me go to the straw out, the tongue out over the straw. Let me go to the cork. Let me go to, brassy, heady. And then you go back and see, yes, now the throat is not as closing. It doesn't close as much. Not, let me show the student that it's closing and I'll show them that this is what it's doing and now they'll do something better. That's not, it isn't like it won't work, but that's a long way around to go. Right? So my job is to know what's wrong and then to know what exercise to do to counter it so that when I go back and do the same thing, it's not the same response. Okay? And this has to do with the way that the muscles, the exercises do the work. Not so much the person. The person should be surprised by, oh, I just went yang for 5 minutes and now when I go back and do what I just did, it's better. Oh. See, then you're really working with the automatic response of the central nervous system for the body to make sound. Because when we're walking around on the street, we don't think about the throat, we just talk. So making those behaviors conscious is partly understanding what is the response that the throat's giving you to the exercise. The exercise is a stimulus, and what comes out is a response to the stimulus. If you don't get the response, you're not given the right stimulus. Okay, now I don't mean to say you should never point out your throat did this and I needed to do that. That's okay. But it isn't the best answer, right? So understanding in level 2, how do we use a cork? How do we use a straw? How do we use the tongue out, the face smiley? How do we use all these devices to create a different response? Again, it's like what this past week, because I'm doing better, they gave me heavier weights in the pool. And he told me to hang on to them with less help from I could, usually I hold on to the side of the pool. He told me no. Made the exercise much more difficult, but I was ready for that. So one, use the tools to get where we need to go. Then we have to take them away and see, can the response still be there without the person having these props to help. And if you do them enough, yes, then it'll still stay even when you take them away. And so it can be developmental, and it can also be corrective. It can be compensatory. Okay, and I know if you're new to this, that could be a lot to take in. But those of you that have been around somatic voice work, this is a really important thing to get, because then you say, well, how does she know? Well, because you do it enough, it begins to say, oh, I need to go over here. And you'll hear that. You'll hear it and see it. We have like 3 minutes left. Maybe one more question.
Sure. And I just want to say I love that I'm hearing echoes of that thread about imitation from the Google forum, which was that was a doozy. Those of you who don't know about the Google forum, we'll tell you about it soon. Well, I guess we can stay with Sandy because there was a question about the loud head register, and you had made a comment about keep it loud for now, quiet will come later. Can you elaborate on your thinking at that moment?
Yeah, when somebody's struggling, loud volume sometimes is helpful because it's like getting a running start. So, if you're gonna jump, and you then you jump, you get further. It's a running start. If you're gonna stand still and jump, you don't go as far. So when the person is struggling to get past a certain place functionally, because that place is no longer normal, allowing it to go where it has to go in whatever way is necessary is something you just tolerate. So if she can only get there loud, then you get there loud, and you don't worry about something else. If she can only get there soft, then she can only get there soft. And this is where we're poking around and we're finding, oh, I can do an E. As Sandy said, she could do the and the E, but not the and the O. Right. Why? Because of the acoustics. If you remember last week when I talked about voice science and the formants and how it changes the parameters, and the air is affecting the shape is affecting the air movement, the open sounds have more turbulence and they use up more air, therefore they're harder to stabilize. Okay? That's not true only for Sandy or only for me, it's true for everybody. That's the laws of physics. That's why we talked about that last week. And if somebody had explained that to me when I was young, my whole life would have been different in terms of singing. But truthfully, they didn't really know that 25 or 30 years ago in a practical sort of a way. We're only really beginning to get some of this now. And then I am doing my best to help you understand. Were we working with the formants in both of these singers? Yes, of course we were. Do I care about that? Not really. But if I know that a smaller sound, a more occluded sound, is going to make it easier for the vocal folds to function, then yes, I do care. But it's really not so much about that as about being appropriate. And Genevieve didn't have any vocal fold issues. She just has functional issues in terms of the style she wants. So that's a separate thing. And both of those, you have to know what you're trying to get, right? And I hope this is a lot for you all to chew on. You can always go back and listen to it again. And if I didn't answer your question, you can still send them in. We'll try to work them in as we go for the next 4 weeks. Now, Oliver, confirm for me, I don't have one next Monday, right?
I believe that is the case. Let me double check.
Okay. That's because I think, next week I'm going to be away. And I think that I would be traveling right in the middle of when this would be. And I had that picked from months ago. So we decided to just leave it that way.
That's what I see. Ain't no webinar without you. So right. Yes.
So next week, don't come on Monday if you're watching in real time. The rest of you won't make any difference. You watch when you watch. Come in 2 weeks, and then we'll do the third session. And I really welcome your feedback. Because in life, if we were in the room after it was over, people come up and they talk to you. Oh, when you said the blah blah, was that the blah blah? Or oh, I never heard that. Or oh, I know about that. I get all that nice juicy feedback from the people who liked it, who were confused by it, who thought it was terrible. Like, oh, I didn't like that, Jeannie. It didn't, I don't know, confuse me. I don't get anything. This thing comes to an end and then you all go away. And I'm like, did I like it? Did I make it crazy? So a little feedback would be nice once in a while, a sentence or two. Okay? And I mean, it doesn't have to be 10 paragraphs, but you can tell me how I'm doing because I can adjust if I am losing you or something else. I can't be other than who I am, but anyway. Oliver, thank you so much for your help and support. And thank you all very much. We are always so happy to see you. Believe it or not, if somebody wants to join us even now, they can still watch today and last time, and they can register after the fact. So if you find that this is valuable and you are liking it and you know somebody that might want to do it, please invite them. And take good care of yourself, and I'll see you in 2 weeks. Bye.
Jeannie, you can stay on just a moment.
Okay.
Looks like there we go. I think the last thing we just want to make sure happens before you end the session on your end is I think you'll see in the upper left hand corner recording, and you just press the little square. That's the stop button.
Okay.